This is something about Mr. Rajanikanth. Of course, it is not a detailing of what happened to him and all. Many people talked about that. As a doctor, usually we don't discuss or give wrong information to the public. A problem which is concerned with somebody's health, it's his private problem. We are not supposed to discuss about a person's health. But being a celebrity and being a public figure with a lot of affectionate followers, I won't say it's a curiosity, but it's a sort of concern. I want to know what has happened. And finally, we came to know what was his problem, and he has recovered from his illness and discharged from the hospital. So, those aspects we are not going to discuss now. What really happened to him and how he got relieved from that, and what was the cause for that, and why he was admitted suddenly like that. Many people want to know that. But remember, this is not a sudden decision, and it was not an emergency. It was an elective procedure only. It was not even a surgery for him which was done. There are many people who may have this problem without knowing that they have this problem. Many people attributed to his problem with many things, including his personal habits and all. But that is not, the actual truth is not that. It is not just because of the habits. There are many factors which resulted in this problem. And one important factor is raised blood pressure. And my point in talking to you today is any person who has got an elevated blood pressure, who is on treatment for blood pressure, should know this condition. And I won't say you should expect this condition. It's not a must. But you should know that there is a sort of complication due to this high blood pressure. Go for an investigations which will rule out this problem. What is it actually Mr. Rajanikanth had? Of course, everybody has come out with a fact that it is what is called abdominal aortic aneurysm. Abdomen means the belly, inside your belly. Aorta means the biggest blood vessel which carries blood from the heart to various parts. It comes out as a single big vessel, and you will get a lot of branches to other organs. When this particular blood vessel is in the chest cavity, you call it thoracic aorta. When it comes down and enters the abdomen, you call it abdominal aorta. You can see from the picture where exactly the abdominal aorta is. So what is that aneurysm? Aneurysm, I can give an example to better understand this. Take a tube, a cycle tube, and you inflate the cycle tube. Sometimes you will get a bulge in some area of the. You say that the tube is weak at that spot. That is why there is a bulge. Weak in the sense that particular tube, the thickness of that particular tube on that area is very thin. That is why it is bulging out. The same thing with a blood vessel. There the tube, here in the abdominal aorta. Blood vessel wall, which is thin at one particular part, it swells. It's not a solid swelling, it's a tube actually. A vessel is a tube, and the vessel wall has got a thickness. And when it is thinned down, then it produces something like a bulge in the cycle tube. You get this. This is called abdominal aortic aneurysm. The same tube, if you inflate more and more, the pressure is more. Now, there are two things. Either the air leaks out of that particular weakened part, or if you inflate more and more, then the tube may burst. So you have a relationship with this complication like leaking and bursting due to increased pressure. The same thing in this aorta. When the heart pumps, more blood comes out, and if the pressure exerted by the heart is moderate, it will be there without any problem. But due to some factors, when the blood pressure increases suddenly or slowly, as age advances, for example, sudden increases in BP may be due to an extraordinary work or severe exercise or anything which increases the BP suddenly, anger, excitement, anxiety. All this can produce an emergency, and that emergency is either leaking of blood or bursting of blood vessel. But remember one thing, this particular problem does not occur like an attack. It is not like an heart attack, or it is not like a stroke. It's a slow process. That means there is a small weakness in that area, and the small weakness increases slowly due to many factors. So it takes some 1 year, 2 year, or 3 years, depending upon the level of blood pressure. The duration it takes to bulge like this may vary from person to person. So what I want to tell is, this should not be an emergency. If you know, then how do you know that you have this problem? I said slow process. So if you have a periodical checkup, an investigation like ultrasound or a CT scan can definitely diagnose this problem. And most of the people do not have any symptoms, so they do not go for they do not even doubt that you may have this problem. But it's during routine checkup, or when you have some other checkup, very much accidentally it is found out that you have got a bulging in the aorta. So what I want to tell is, better to have a periodical checkup which includes an abdominal ultrasound scan. Look for this. What are the factors which contribute this outcome? We call them as risk factors. That means if you have this problem, the possibility of getting this particular problem is more with you. That is what a risk factor. The very first thing is age. As age advances, the possibility of getting this problem is more. When your age increases, the blood vessel wall, it becomes rigid. The elasticity of the wall is lost. One. So when the elasticity is less, the heart has to pump with more force, more pressure. Definitely, the vessel wall will try to bulge because of the pressure. If the blood vessel wall is narrow due to deposition of cholesterol, etc., the wall becomes weak on that spot. The blood is forced into this area by the heart with more pressure. Naturally, this area may give way and it may bulge. Of course, behaviors or habits like smoking. This problem would have been a genetic problem, inheritance, family history like this. It may be another reason why this problem may be. I said narrowing of the blood vessel. Normally, the diameter of aorta will be around 2 centimeters. But when the diameter is around 5 centimeters, then definitely you call it as aneurysm. So I said the heart has to pump with more force. When the force increases, naturally the pressure increases. So very, very, very important reason for this problem, blood pressure. So when you have high blood pressure, definitely the possibility of getting this problem is more. Trauma, sometimes they have got some blunt abdominal injury, and because of that, that blood vessel would have got weakened. That is a very rare possibility. The integrity of the blood vessel wall, after all, it is made of smooth muscle cells. The muscle cell may die due to many reasons. So it is not just one factor, but there are a lot of risk factors. It's a symptomless defect actually. It's not a disease, It's not a disorder. And as I said, it develops very slowly. And if there is a pain like this, then that may become an emergency. When you have a periodical examination, try to have an ultrasound abdomen and try to know the integrity of this aorta and other blood vessels also. So this is what aortic aneurysm. Then what was the treatment given to him? What they do is, you have a bulged area, you have a weak spot, and you have a healthy normal aorta just above and below this swelling or this enlargement. Now, if I have a small stent like thing, when I just introduce this stent and make the blood to pass through this stent, then naturally the problem is solved. You can see in that picture. So when the blood comes out of the aorta, out of the heart, and comes down, so that weak spot is not disturbed by the blood which is coming out of the heart. So it's a procedure. It should be an elective procedure. It should not be an emergency procedure. In fact, even for a star like Rajanikanth, they would have known this problem during routine checkup, and the doctors would have advised him to go for this type of a small procedure. And what I heard is, of course, it was planned, but before that, he developed some abdominal pain. That is why he was rushed to the doctors will not give you 100% detail about this. What was the size, what was the extent and all. But remember this is a sort of complication due to high blood pressure, age, atherosclerosis, cholesterol deposit, etc. And you can avoid this problem by controlling the blood pressure adequately, periodical checkup and all. So this is the information I want to pass on to you, that, and let us not probe into somebody's private affair like medical and health problems like this. That is, the doctors will take care of all those things, and once the problem is solved, the doctors will definitely give a report what really happened to a particular celebrity or public person and what they have done, and they will assure that the person will do well. So at least now you know there is a condition called aortic aneurysm or abdominal aortic aneurysm, why this problem occurs and how to prevent this and all. So many times when a celebrity gets a problem, only at that time we'll be much interested in knowing about that problem. If this has not happened to a person of that caliber, then you may not be interested in knowing about this problem. So this is what I wanted to convey through this video. We'll meet with some other video next time. Thank you.